Okay,
That
everyone, let's get started today. Welcome. Good morning, good afternoon, good evening. We're so excited you're here and you're joining us for the kickoff of the Scaling Up Health Adaptation Measures to Meet the Climate Change Challenge in the Americas course. My name is Cecilia Sorensen, and I'm the director of the Global Consortium on Climate and Health Education. And we're thrilled to see you all here today. As we get started, I'd like everybody to be aware that we do have interpretation available in several languages. So you can select French, English, Spanish, or Portuguese using the globe at the bottom of the screen. There's a icon that looks like the world. You click on that and you can select your preferred language, and we will have simultaneous interpretation available throughout this course. All right. Well, this is a very exciting moment today. As many of you know, the reality we face is very stark. Climate change is no longer a distant threat, but really is an immediate challenge, which is demanding urgent, coordinated action across our health systems. Across the Americas, we've been seeing intensifying hurricanes, devastating wildfires, and coming to understand that although we have some solutions available, we are not moving fast enough nor scaling our solutions quickly enough to be meeting the needs in our communities where we are seeking to protect health. So this is our goal of this course, to think about how we can scale adaptation to make the transformational changes that we need. So over the next 11 sessions, you'll be joined by colleagues across the Americas, including health system leaders, emergency planners, sustainability officers, public health officials, and more to explore how we can transition system-wide resilience. We created this course not necessarily because we have all the answers, but as a means to understand the current state of practice and to share with each other inspiration, ideas, and solutions. So because of this, we don't consider everyone here to be simply participants in the course. We will be asking you for your active input. All of us are here today because we will, in some way, be the leaders who will drive the scaling up efforts our communities desperately need. Before we begin, I'd like to express my deepest gratitude to our exceptional partners who made this course possible. Health Canada, the Pan American Health Organization, the Inter-American Institute for Global Change Research, Earth Medic and Earth Nurse Foundation for Planetary Health, Brazil's Ministry of Health, the World Health Organization, and the United Nations University. Their expertise and commitment to climate and health education has been invaluable in bringing you this comprehensive learning experience. With that, I'd like to turn it over to Daniel Boos, who is the Unit Chief for Climate Change and Environmental Determinants of Health at the Pan American Health Organization. Over to you, Daniel.
Thank you kindly, Cecilia. Thanks a lot for the opportunity and for being here today with us. Buenas tardes, boa tarde to all people in the Americas that are listening to us today. It's with a great pleasure that we at the Pan American Health Organization welcome you to this very important training course together with GCCHE, University of Columbia, WHO, IAI, Health Canada, and many other partners that we're going to hear from them today and for this next few sessions that we have preparing ourselves to the COP30 that's happening in Belém do Pará this year in Brazil. And I'm very happy as well to count with the support from the Brazilian government and the leadership from the Brazilian government in the region of the Americas. This is becoming much more evident, the leadership of countries of the Americas in these topics of environmental health, as we had, for example, last year, Colombia leading the COP16 biodiversity with the establishment of a new global plan on biodiversity and human health that now is triggering a whole plan of action that we count with your support as well to implement throughout the Americas. And at the same time, we had not only Brazil playing a leading role in many actions regarding climate change and health in the past, but as we know, this year we already had two big events as a consultation for the Belém Health Action Plan, which is meant to be a global framing for climate change and health with a special eye on adaptation measures for the health sector, which is crucial to achieve, including what's being discussed as well in COP30 later this year, the global goal on adaptation that has many indicators that are health related, as well as to support our implementation of a new loss and damages funds and assessment for the countries. So I think that this course will give us a lot of these tools, a lot of the energy that we need, because we could remain committed to the multilateral and intersectoral collaborations. I think that all that are here, we are very thankful for your support to also support these ideas of multilateralism and intersectoral collaboration, that we think that it's the only way to move forward, or the best way to move forward and tackle those issues. As Cecilia was mentioning, we had in the Americas, for example, last year, the hottest year on record. We had at least 56,000 deaths associated with heat in the Americas. That might be an understatement on my side, because more and more data is coming. We also had floods and droughts, for example, affecting the same country, like Brazil, north to south. The Amazon rainforest was in one of the drier periods in history, or recorded history. We had over 13 million cases of dengue recorded in the region, which was the highest on record, as well as the earliest Category 5 hurricane in recorded history in the Caribbean. So, I mean, I could go on and on, unfortunately, with the effects of climate change to human health and to societies. But I want to end this short introduction with the bright side, that we are all here, that we know that we have very successful cases in countries of the Americas, and we are going to show you many of those during these days, and we hope that we can learn from you as well, what you're doing well in your countries, what are your challenges, and what are the barriers that we need to overcome together. So count with PAHO to do that, count with all the partners that are here in this course, and thank you very much once again, Cecilia, for the invite to be here. Thank you.
Thank you so much, Daniel, and a huge thanks to the Pan American Health Organization for being such a tremendous partner and putting so much leadership and priority in this space. I'd like to now turn it over to Caroline Tedeschi, who is the Director of the Climate Change and Health Office at Healthy Environments and Consumer Safety within Health Canada. Over to you, Caroline.
Great. Thank you so much, Dr. Sorensen. Good morning, good afternoon, bonjour tout le monde. It's a real pleasure to be joining everybody here today for the first session of the Scaling Up Health Adaptation in the Americas course. First, I'd like to acknowledge that I'm joining you from Ottawa, Canada, which is the traditional and unceded territory of the Algonquin Anishinaabe people, one of the Indigenous populations in Canada. It's a great pleasure to be for Health Canada to be collaborating with Dr. Sorensen on a third course and with the Global Consortium on Climate Change and Health Education, World Health Organization, PAHO, and all of the other partners who have helped organize this course and increasing and such an importance of increasing relevance for health decision makers as they tackle climate change. Unfortunately, in Canada, as in many other countries, we are seeing the dramatic effects of climate change already impacting the health of our populations and our health systems. And the health authorities in Canada are recognizing the need to move further, faster with our health adaptation efforts. We're seeing extreme heat events, wildfires, floods, the spread of vector-borne infectious diseases, and along with these impacts, we're seeing disproportionate impacts on our older populations, children, Indigenous peoples, and other populations that challenge us to make even greater strides in our efforts to prepare individuals and our health systems. We're really encouraged, though, by the recent growth in interest, engagement, and activity by health professionals in Canada and around the Americas. This really gives us a tremendous opportunity to share all of our experiences about scaling adaptation efforts quickly, undertaking vulnerability assessments, developing health adaptation plans, and measuring our progress towards climate resilient health systems. And this unprecedented challenges facing the health community is why this course is so timely and important. I really look forward to participating in the course by sharing information at a later session about some actions being taken in Canada. And I'm going to really enjoy learning from all of the other participants and their experiences. So thank you all for being able to share with us. I hope everybody enjoys the course and that it supports the much needed work ahead. Thank you very much. Merci.
Thank you so much. We are so tremendously grateful for Health Canada, for your entire team, for bringing their expertise to bear on this course. I'd like to now turn it over to Dr. James Hospitalis, who is the CEO and founder of the Earth Medic and Earth Nurse Foundation for Planetary Health. Over to you, James.
Thank you, Cecilia. Good afternoon, buenas tardes, bonsoir, bon dia. I'm very happy to bring you greetings on behalf of Earth Medic and Earth Nurse Foundation for Planetary Health. We were established 5 years ago to really mobilize the health professions to address the climate crisis. Health professions everywhere are trusted messengers, and we really need to be adding our voice to this. I see a lot of people here. I'm based in Trinidad and Tobago. I see a lot of participants from the Caribbean. I'm really happy to see you and look forward to your participating in and benefiting from this course. Thank you very much.
Thank you so much, James. Again, this is an incredible partnership which has designed this course and come together to make sure that this opportunity is available to as many people as possible. So we have an exciting 11 sessions lined up in the run-up to COP30 this year. And our hope is that through these sessions, we strengthen our knowledge as a community in terms of what we understand about the current state of adaptation actions and how we can move faster and how we can move together to go farther to protect the health in communities. What you see here is our course schedule. Obviously, we're starting today with our introduction. We'll be trying to understand what the current reality is around health adaptation and the challenges we're facing. And then we'll be spending the next 10 sessions talking about solutions. Survey where we would love to hear from you. If you follow this QR code or you follow the link that's in the chat, you have an opportunity to submit a case study, which we will review all the submissions and select several case studies to be presented in both sessions 5 and/or sessions 9 of this course. And these are special sessions, which we're calling Listen and Learn sessions, where we would like to hear from you as course participants. And we will invite you to come and present your case studies, where we will be able to talk about the case study and try to glean lessons learned from what you're seeing in your communities. So I encourage you to fill out this form, to contribute to this course, and tell us what you're seeing on the ground. It is so important as we move forward. Next slide, please. Okay, we also have a WhatsApp group. WhatsApp is available hopefully everywhere in the Americas. If you don't have it, you can download it on your phone, and then you can scan this QR code, and through the WhatsApp channel, we will be able to share important course announcements with you, and we'll be able to sort of share relevant articles, give you links to things that may be of interest. So we encourage you to join our WhatsApp group so we can all stay in touch. Next slide, please. So without further ado, we have some incredible presenters who are giving their time to us today to share their exceptional work. Our first presenter today is Dr. Agnes Suarez de Silva, who is the Director of the Department of Environmental Health Surveillance and Workers' Health within the Secretariat of Health and Environmental Surveillance of the Ministry of Health of Brazil. Previously, Dr. Suarez de Silva was the Regional Advisor for Environmental Epidemiology at the Pan American Health Organization, and she additionally served as an interim head of the Climate Change and Environmental Determinants of Health Unit. We're so delighted to have you here today. Over to you, Dr. Suarez de Silva.
So it's so good to be here, and I'm really excited to see the amount of people following the course, and I'm sure that we can at the end see an increase in the involvement of the whole health area in climate change action. So I would ask for you to move the slides that I'll be presenting. So before we talk about the solutions, I think it's important to know what the big problems are. And of course, when we propose solutions, we need to think on how to solve the problems that we are seeing, not only in general, but also to the populations that are in situations of vulnerability. And it's important to say that 79% of the deaths related to extreme weather events that were monitored since 1991 have occurred in developing countries. This means that in fact, the vulnerability is not equally distributed, and we need to take that into consideration also when we think at a country level. And this is an important part when thinking, assessing vulnerability. To the second slide, please. So when we look at, we talk about global warming, and it's difficult to say that we don't know what's happening because most of us have already lived through the increasing number of days we have heat waves. But in 2024, we had the highest annual average temperature, and it was above 1.5 degrees Celsius above the pre-industrial average age. That's when we particularly analyze the global warming and the global temperature. So it was the hottest year ever recorded, but the 2023 was also the warmest before. And this trend is what draws attention to public health, particularly to public health officials in charge of protecting the health of population. So in most of the continental areas, we saw that that is happening, and it's not the type of temperature that we're used to in the areas that are used to warm weather. It's much more than that, and it becomes sometimes unbearable. The next, and when you see here, there is a 30 years average monthly temperature in Latin America. You also see this trend in becoming warmer and warmer for each month of the year. And the Caribbean has presented the greatest increases in average temperatures in the last 100 years. So this shows how we need to act quickly in adapting the health systems, adapting the health workforce, but also increasing resilience of communities. And next. If you think on the impacts, so we saw, of course, each place of the world has felt it differently, but we saw in South America, and particularly in the Amazon lowlands areas, but also in Pantanal, a very drier than normal year, and also in Mexico and some islands in the Caribbean and parts of North America. And this also has brought many other issues related to the dry weather, like wildfires that has caught Chile and with more than 300 deaths related to wildfires, but also in North America. And this happened also to increase displacement, not only within countries, but sometimes across borders. And this means increased burden to the health sector. And extremely daily temperatures of 50 degrees or more in 1 year between 23 and 24 affected many parts of the world, and many of them that have never experienced it, such extreme temperatures. And this also made, I think, part of the problem, and we see that it grows across problem across borders, and as we saw, particularly with the wildfires, the smoke going through different areas of the country that were affected, but also in areas where there was no wildfires, but they were affected by the smoke going across the areas. And we also saw many of the diseases that were limited to places that were under surveillance already, vector-borne diseases spreading throughout the region in places where they were not expected at first. Next. And if we think that most part of the diseases that are infectious diseases or vector-borne diseases, but the infectious diseases in general, 60% can be affected directly or indirectly by climate change. So this is to bring the attention that how much the health systems need to adapt. So it's not one part of it. It's not only some diseases. It's the whole system that can be affected. Next. When we think that on vulnerable populations or population in a situation of vulnerability, I think everyone has in mind the elderly, but think about the children that will be exposed throughout their lifetime to this increased temperature. So climate change could push at least 5.9 million more children and young people in Latin America and the Caribbean into poverty by 2030, unless something is done to prevent pre-existing inequalities that could deepen because of climate change. Next. So the sources are anthropogenic in the majority of cases. Even when we think about wildfires, it is something that was caused by burning fossil fuels, but also occupying areas of forests, decreasing increasing their vulnerability to to be resistant to wildfires. And this means that it will bring, and it is bringing already, many of the effects that were that we knew already that could happen, and it affects health, but also indirectly health through food insecurity, to problems in water and sanitation, to livelihoods that are affected, and it makes it difficult health service delivery even when the health systems exist and they are in remote areas and in areas that are frequently affected by the impacts of climate change. So, as I've mentioned, the effects to health systems are the effect to health can be very broad, from non-communicable diseases to communicable diseases, vector-borne diseases, and indirectly through food. But it also affects deeply health systems, and that's the last, I would say, it's maybe the last way to protect people from the effects of climate change, and the way to at least make sure less people will die due to the effects of climate change. And that's the reason we need to think on the effects on health, but also the effects on infrastructure and the way the systems are organized. And next, this is just to think how we are putting future generations into higher risk. So the way the year you were born, we can tell how many years you will be exposed to higher temperatures, and that will increase the chances to live well and live longer. So that's the type of decision that policymakers and need to think about, and what we can do to protect the health of the population. So the next slide. That's the reason, in a way, why the COP30 presidency of Brazil is calling for this mutirão against climate change. So it's calling for mutirão, is like comes from a indigenous word mutirão, that means coming together to defy very complex problems, to solve complex problems. So that's what we need to do now, is to think and act differently than I have done before, and in doing this together, and in common agreements, and working with the best solutions that we can find. Next. So we'll be talking much more on adaptation, because this is our main task, or that's what we need to do when we are in the health sector. But of course, we need the mitigation part, that is reducing or preventing the emissions of greenhouse gases into the atmosphere, because otherwise we'll keep burdening the systems and burdening the health of everyone. So we need both, and the health sector has also to contribute to that. But mitigation we do in the health sector in the context of adaptation. So if we have to work on delivering services, we also need to think on renewable energy and sustainable energy sources. The next one. So thinking on health systems as playing a critical role in all climate actions. When we talk this is not only talk. It's because health is connected to almost everything that happens in society. And so there are many barriers to work on, and to think on the solutions, how we respond properly, but how we prevent, and how we engage the whole society and the communities in this response, and making sure that we will prevent inequities to increase as well. And thinking that we need to have universal health coverage, otherwise we won't be able to respond adequately to climate change. Next. So adaptation, the investment in adaptation is to strengthen resilience. And the more we have social participation, the more we foster the engagement of all sectors in building solutions. It's and also thinking on how to ensure ethnic racial equity. This is the more we do that, the sure we are that we are protecting the whole population. And next. So there are economic benefits when we do that. And when the health sector is involved in adaptation, it mobilizes also forces that will help to move forward in this action agenda of climate change. So there are many ways of participating in it, and the participation of the health sector in finding solutions will help also finding solutions to the entire community, and also to the helping advance the gains we need to have in the negotiations processes in the climate change agenda. So next. So there is no way we can think on adaptation to climate change without thinking on how to create resilience in the health systems. And building a resilient health system globally may play a pivotal role in safeguarding and promoting public health. And that's the reason Brazil, the next slide, please. Brazil is proposing the Belém Health Action Plan. So it's no more a declaration. It's not something that will bring completely new. It's based on solutions that have already started or we know already that work and needs to be scaled up and brought to the attention of everyone and prioritized. So the Belém Health Action Plan, it's more like an umbrella for the adaptation, for solutions, and it will help countries to build their systems more resilient, but also bring more the action for the health sector into the center of climate discussions. And what we are proposing has two cross-cutting priorities, and one of them is on health equity and climate justice, and the other is on leadership and governance on climate and health with social participation, because there is no way to find solutions if we don't involve everyone in this process. And the three lines, the main lines of action would be on surveillance and monitoring and on evidence-based policy strategy and capacity building and on innovation and production. And I must say that with this, we would have something around 16 outputs and 81 actions that were selected as explained already, Daniel, both in broad consultation with academics, with the representatives from different governments. In the last global conference on climate and health, we had 92 countries representatives discussing how to move forward this agenda, and we received many comments and suggestions to this plan. So it's simple, it's actionable, it's not something that you will need too much of explanation. And it includes, for instance, improving climate-informed health surveillance, identify a priority list of climate-related risks and diseases, and improve health risk management in climate events and emergencies. And from this on, and also like on innovation and production, this means really doing something different, not being creative, like faster just transitions of the health sector adaptation, and evaluating innovative adaptation policies in the health sector. This will need to engage new products sometimes, but sometimes it's just increasing capacity to implement things that already exist. And this is the way of proposing global action and having an agenda that will be transparent, commitments that will be monitored, and we will follow the advances. So the next slide, I'm talking a little bit of our national adaptation plan for the health sector. So in Brazil, because one thing is what we agree at a global level that we need to invest and make sure our voices are heard in a larger global health community, but also talking to other sectors in particularly to have this agenda included in the climate discussions at COP, and particularly now at COP 30. And so the Adaptation, the SUS is the unified health system in Brazil. We designed this adaptation, the health adaptation plan, with the general objective of establishing adaptation strategies at the federal level of the SUS management to reduce the impacts of climate change, of people's health and of health services, and to define guidelines to guide the actions of state and municipal levels. This is because we are a federation and we need to discuss at the three spheres of the government. And this plan is specific objectives of health surveillance, healthcare, health promotion and education, and on science, technology, innovation, and production. And with goals and actions at each one of them that were agreed with the different sectors. So it's not a task for the people working on the environmental health unities or departments, but it's a task for the whole health community. And the next one. So what we are trying to do is really go deeper in this discussion. It's not only the broader discussion on how climate affects health, but it's also how we identify climate change as an accelerator of inequities. Therefore, we need to identify how to address that at each country, but also when we think at a global level, how we can work in a way that we will decrease the impact on inequities, not only on health, but on health inequities. Also, how we can put health at the center of the global climate action agenda. And thinking that the Belém Health Action Plan could provide a global platform for cooperation at a global level. But this means we also need health adaptation and plans like we have the Adaptation. Every country will need to think what are the solutions that are the best solutions for each part of the country and for the reality that the country lives. And depending on how well the health systems are structured, how well the workforce is prepared, and how is the commitment at the highest political commitment that is possible in the country, how this is already done and how much you need to work so that happens. So that's what I would like to share with you, and I'll be happy to answer to any questions or comments.
Thank you so much, Dr. Suarez. Really exciting to see all the incredible leadership and the work happening around the Belém Health Action Plan, which really serves as a framework for countries to move forward and to accelerate their climate adaptation and mitigation commitments. I'm sure we will have a ton of questions for you. And those of you who have questions, please put them in the Q&A section of the Zoom platform, and we will get to as many as we can. Right now, we'll transition over to a couple of our case studies. And with that, I'm delighted to introduce Tamir Rabi, MD, who is the Global Program Lead for Climate and Health at the World Bank. As a medical doctor and public health specialist, he joined the bank in 2005 and has been leading lending as well as advisory services across more than 30 countries, including those characterized by fragility, conflict, and violence. He has over 25 years of wide-ranging policy, public health, and health systems experience, including in climate change, nutrition, reproductive health, service delivery, governance, the private sector, and environmental health. So we're so delighted to have you here. Over to you, Tamir.
Excellent. Thank you so much, Cecilia, for the introduction, and many thanks actually for having me join this session today. I'm thankful to the Global Consortium on Climate and Health Education for organizing this session and for bringing together a wide range of actors, practitioners, policymakers into this discussion. I want to start off at the beginning by just providing a little bit more of a framing, adding further on what Agnes has presented as well. And I think it's extremely important to be able to see also the economic impacts of the climate crisis on the economies. of how countries are having to grapple, if you will, with the impacts of the climate crisis in terms of really providing for enough of the physical space to be able to scale up action. And in this context, I want to just showcase a report that we launched at COP29 last year, where we showed that the cost of inaction is just huge. We're looking at nearly $21 trillion in terms of economic losses by 2050 in low and middle income countries, which includes obviously many countries in the Latin American Caribbean region, and that actually constitutes nearly 1.3% of global GDP in those countries by 2050. Now, I think the main message also to highlight here is that, most of those that are having to bear the brunt of these economic costs are actually not the ones that are responsible for the climate crisis. And I know that I'm highlighting sub-Saharan Africa and South Asia, but the picture is no different when it also comes to Latin America and the Caribbean. And the costs that we're showing here, it's extremely important to also emphasize that it's only the tip of the iceberg. And the reason I'm saying this is because these costs were only based on 5 climate-sensitive health outcomes. So if we were to consider a broader range of health outcomes that are driven by climate hazards and exposures, these figures would be far, far higher than what we're seeing. In the World Bank, we've committed ourselves last year at the time of the spring meetings to really expanding our coverage and working with countries and partners to reach 1.5 billion people with quality, affordable health services by 2030. And to do that, this is going to mean that we have to integrate climate action within the scope of what we're doing and to ensure that actually climate is part and parcel of what we do on health systems strengthening towards universal health coverage. On the next slide, what I want to be able to show, once the slide comes on the screen, is just basically a risk index. Thank you for putting that up. So we created a climate and health risk index to be able to really understand, if you will, how countries fare in terms of the impacts of climate on each of those countries. And this is coming in really to assess the confluence, if you will, between the hazards, i.e. climate hazards, the exposures at a country level, as well as the vulnerability, which is made up of adaptive capacity of those countries to be able to deal with the impacts that they're seeing, from the climate crisis. And as you can see, even in the Americas, we're also seeing, quite a fair impact in terms of climate exposures on these systems and how they will need to be able to increase their resilience to be able to face these exposures, as well as deal with the adaptive capacity of those systems that exist in those countries is going to be critical moving forward. Now, the way I'm going to structure my case study is really to walk you through what I believe is a continuum. At the beginning, what we need to be able to do, and we can see this on the next slide, what we need to be able to do is to contextualize to get into country context, to be able to contextualize really the problem that we're facing, so that when solutions are put into action and when financing follows, as a result of that those solutions are then geared towards what we're seeing around the impacts that are driven by climate hazards. And therefore, what we've done in the World Bank is we've developed a climate and health vulnerability assessment. Many other organizations have also been doing their own vulnerability assessments, but this really tries to capture a little bit more of the operational sort of entry points that we provide investments for. And this climate and health vulnerability assessment, it comes in really to focus, as you can see, there are 2 sides, if you will, of what's shown on the screen. On the left-hand side, it's coming in really to look at the epidemiological links, looking at the pathways that Agnes presented in her presentation, really trying to get that sense of the granular sort of details that we need to be able to understand at a national as well as subnational level of what is driving the health impacts that we're seeing in those contexts. At the same time, this is really about measuring the impact, if you will, on overall health system performance, including the capacity of the system to be able to adapt and to be able to respond in times of shocks. And also, it takes into account the lifeline infrastructure, leading to service delivery points. And we, on the right-hand side of the screen, this is now what takes us a little bit more then into the operational space. How do we then make sense of what we've been able to see in terms of this context to translate it into meaningful solutions that would be tailored to country contexts? And here, I'm highlighting three main areas that we're focusing our attention on, looking obviously at health services and the pathways and programs that are put in place. How is it that we could, through our thinking of scaling up solutions, redesign service delivery models so that they are more orientated towards climate action, ensuring that primary healthcare is at the heart of what we do. This is also about obviously focusing quite exclusively on what we do around the human resources for health agenda, and how is it that we could gear the next generation of health professionals so that they're not just climate informed, but they have the means and tools to be able to act on this, while at the same time also thinking about the enabling structures, including obviously the governance structures that need to be put in place to drive action. So this climate and health vulnerability assessment is a way of really trying to think of contextualizing action at a country level. So on the next slide, I want to be able to show, well, how have we been able to use this? And I'm here showing a particular case. This is coming in from Colombia, where we've been able to do a climate and health vulnerability in Colombia to assess really, the impacts in terms of deaths, years of life lost. We're able obviously to show which parts of the country are more affected when it comes to impacts from heat. But also, let's not forget that this is not just about heat. It's about extreme weather events, so including deaths from cold, which is also a common factor that we're seeing in a country like Colombia. So on this slide, you can see how the country looks like in terms of its risk. And based on that, obviously further assessments were done to be able to take us really into understanding the subnational level and how is it that we could be scaling up solutions to do this. On the next slide, what I show is that, within this scope of understanding vulnerability, it's also important to be able to understand the economic burden that is attributable to climate exposures. And in this case, I took a specific example that is focusing on non-optimal temperatures around, obviously, heat and around cold. Now, the reason I brought this in is because we need to also be mindful of the fact that when we are in discussions around climate and health solutions, finance is a big component that we have to consider. I took note of everything that Agnes was talking about in her presentation. This is a crisis. This is a health systems issue that we need to deal with. This is an equity. There's a huge equity dimension to this that we need to be able to factor in as we think about solutions. Governance is at the heart of this, but equally so, financing is important. So what I'm trying to show with this slide is that for us to have a meaningful conversation at a government level, we need to also be able to speak the language that ministries of finance will be able to understand. We need to be able to put forward the arguments for why inaction is just not an option. Why is it that we need to be able to focus on actually bringing in finance and scaling up solutions for that? And in the case of Colombia, as you can see, and this has helped hugely in the way that we have been able to interact with our partners in the Ministry of Finance, and really talking about the economic burden from these non-optimal temperatures, that could reach up to 3.3 trillion pesos. Actually, this was a calculation based on what we've seen between 2010 and 2019. It contributes to the overall losses to nearly 0.4% of GDP in 2019 in Colombia. So it's not trivial. It's not something that we could completely push aside. And it's very important as part of this overall discussion and discourse that we have at the country level. On the next slide, what I want to be able to do is shift gears a little bit from just focusing, on, understanding the context. I mean, this was the analytics, if you will, on this. There's a wide range of analytics that can come into this space. And then perhaps, and I was trying to highlight with the previous slides that there's a role for everyone. This is about collective leadership. This is about collective action. And this is about ensuring that we're speaking to different parts of the system, including those in academia academia, those in non-governmental organizations, bilaterals, multilateral institutions, international financial institutions, so on and so forth. Now, if we take that now to a programmatic level, and I'm using now the case in Chile, and this is an example of how we've been able to scale up action with a focus on primary healthcare and expanding coverage in a country like Chile. And mind you, just look at the context that we have at the beginning. There's huge social and political momentum, and what are they demanding for? They're demanding for equity. People are demanding for better quality of services. They feel there's inequality, especially among vulnerable groups, and therefore a particular focus on vulnerable groups and how we could reach those vulnerable groups was really at the heart of the design of this program, while also understanding the fact that within the inequalities that we're seeing in a country like Chile, there is also huge income disparities that have led to obviously poverty and is further impacting on people's lives and livelihoods. The public insurer, in this case, coverage is around 80%, but there still exists a lot of gaps in terms of accessibility services. And in many cases, satisfaction, with the primary healthcare services that are being provided is not matching the population's needs and demands. And Chile is one of the top 25 climate vulnerable countries that we have looked at. And therefore, obviously, for us to be able to expand further our interaction in Chile and to expand what we are able to bring into climate action, this had to then come in and really focus on, well, what is it we can do to increase resilience with a particular focus on enhancing quality of care and also resource efficiency. So the program itself, it was made up of a number of different components. And the first one really come to focus quite exclusively on how is it that we can expand high quality coverage for primary healthcare in this context. And I want to say that by 2027, the aim of the program is actually to scale up the scale up primary healthcare service delivery in around 187 municipalities in the country. And when it comes to thinking about resilience, there's a huge component around human resource for health capacity and capacity building. There's a lot of focus on areas that Agnes has spoken about also as part of the Belém Health Action Plan around surveillance systems and early warning systems and how we can strengthen that. And we're working very closely with the government to ensure that surveillance systems as well as early warning systems are upgraded to match the scale of the crisis. We're upgrading infrastructure within PHC facilities, and this first phase of the program is really a pilot in 7 municipalities, but coming in really to focus, as I mentioned, on the increasing coverage, improving resilience, thinking about the service delivery model in light and in relation to to all of the contextual factors that we've spoken about, and to obviously enhance quality. But I also want to point out that it's also about efficiency. And the reason I'm saying this is because this is about, again, what is the return on investments that we're putting in a country like Chile? And how can a program like this really drive forward the efficiency as well as transparency in how resources are used? So in this case, what we've been able also to do is put together a virtual health management platform to really allow us to monitor and track how resources are being used and how they're obviously pushing also on these different dimensions that I've been speaking about. Now, on the next slide, I just want to be able to, again, shift gears slightly to say that, this work that we're doing is not just about a single institution. And this is why, in the lead up to COP28, we put together the first development bank working group for climate and health finance. This really came with the main aim to harmonize tools, resources, to bring in synergistic financing across the development banks to scale up action and to ensure, obviously, that there is alignment in what we do. Now, Within this group, it brings in together the multilateral development banks, but we're also working with public development banks. And I'm actually delighted to mention that the Brazilian National Development Bank is also a part of this working group. Together, what we've done is we've been able to put a joint roadmap for climate and health finance, and we launched this last year in June. And the roadmap, it actually specifies a number of different pillars on how is it that we're going to be working together to be able to advance our thinking around climate and health finance in action. And in one particular pillar that I want to point out is pillar number 4, where it's about supporting country-driven evidence-based interventions. And the reason I'm pointing this one out, it's going to show up in my last slide, is because it's also coming in to support what is happening right now as we speak in the preparation for COP30. How is it that we could support the Belém Health Action Plan and bring in really the evidence that is out there on what is it that is showing the highest rate of return on investments, as well as, you know, those interventions that really would be meaningful for countries to scale and the innovations that can come into this space. Next slide, please. On my next slide, what I want to also be able to point out, and you know, there's a number of countries also from Latin America and the Caribbean that are part of this effort. We put together a joint learning network that is coming in to focus on how do we work together collectively to put in place a climate smart health system. And through this engagement with the Joint Learning Network, which brings together 22 countries across the globe, what we've been able to do is facilitate practitioner-to-practitioner learning. We're working together to go develop some of these solutions. And you can see some of the products on the screen. This is just in this first year. In fact, I'm going to be in Bahrain in a couple of weeks, working with all of our partners in reviewing these knowledge products that have been developed. And these are led by the countries. They are driven, the focus of these products are driven by those countries as they see it most fit. So it's fit for purpose in terms of what they would like to see, being driven forward. So there's a focus on governance. Again, speaking to what Agnes, mentioned in her presentation as well, and moving really the needle on what it means to be scaling up climate and health governance at a country level. What would be the guidelines for that? How do we maximize finance and making the case for investing in climate and health so that we could have more of that discussion, if you will, with the financiers, be it within governments so that we can influence domestic resource mobilization, or be it with international financial institutions that can bring in more of the climate and health investments that are needed. We're putting together a repository of guidelines for costing, for budgeting, for thinking about public financial management. All of these are important facets as we think about how we scale up climate and health finance. And data and accountability is at the heart of what we've been able to work with these countries on, to be able to see how we integrate data across sectors, including obviously meteorological data, as well as health data, and using visualization toolkits for that, while at the same time having a specific focus on how we can increase transparency and accountability through monitoring mechanisms. So my last slide coming up in just a second is in fact the way forward. This is how we're thinking about it collectively, working with so many partners under the Alliance for Transformative Action on Climate Change and Health, as well as with the Development Bank's Working Group for Climate and Health Finance. So we're working with 30 plus partner institutions on 2 main tasks. The first one is focusing on what we're referring to now as the high value climate and health adaptation solutions. We used to refer to this at the beginning as the best buys, but over time, the nomenclature evolved, given the fact that we realized that there's a lot that we still don't know. There's a lot we know, but there's still a huge gap in terms of what we don't know. We don't know a lot in terms of the interventions, how they've been evaluated, or if at all they've been evaluated. So we're doing we did a systematic review to look at all of these high or highly effective, if you will, interventions. But we then took it a stage further by applying an economic costing model on this, using really a cost consequence approach that looks at the benefits cost ratio of investing, for example, in a particular intervention. So what would be the returns for every dollar spent on interventions? Of course, we have a candidate list of interventions that are all going to come and feed into the Belém Health Action Plan and support what the Belém Health Action Plan is putting out, to the world. And this, it's not a surprise to say that, a lot of what's going to come into here is going to be solutions like, of course, surveillance systems, climate smart, health facilities, early warning systems, but innovations like the use of drones, for example, in supply chain, and how you could further expand all that. And at the same time, in thinking about these high value, climate and health adaptation solutions, it's important to highlight that while we are coming up with this at a global level, it needs to still be taken down to a national as well as a subnational level to contextualize these solutions, to be able to prioritize within country contexts what would constitute the highest value for money in terms of the investments. Because one solution in a particular country does not necessarily mean that it is the best solution for another. And this is why the second task on the costing and prioritization comes into play. Really thinking about, well, what would constitute the best methods for us to move forward on a full-fledged costing and prioritization exercise, bringing together practical methods, and we're working very closely with partners, obviously in the World Health Organization and others, on making sure that these costing and prioritization methods are put out there and they're made available for countries to use. Let me just end on the note, and this was my final slide, just to remind everybody that this is indeed a collective action, that we have to be working together in tandem with so many different partners, but let's not also forget the role of the private sector in doing this. While I've not highlighted any particular case studies on the private sector, I think it's going to be fundamental that we do not necessarily see this just as a public sector issue, but it has to be all hands on deck, all of society, and ensuring that climate action is integrated in health systems as a whole. Thank you so much.
Thank you so much. And yes, the private sector being an incredibly important partner and player in this space. We'll be joined from some good partners from the private sector later on in this course to talk about how we can engage and collaborate. So thank you so much for sharing all this. You have about 20 questions so far about the work, but we'll get to as many as we can. I think it's just so interesting and so relevant. So thank you for sharing what's going on your end of things. I'm going to turn it over now to Dr. Charles Gardner, who is the Medical Officer of Health for the Simcoe Muskoka District Health Unit in Ontario, Canada. I hope I said that right. Please correct me. Who is joined with his colleague, Sarah Warren, who is a health promotion specialist within the Emergency Management and Health Hazards unit within the same health district. So over to you both. Thank you so much.
Thank you very much, Cecilia, and welcome everybody. Bonjour, buenas tardes, and I look forward to engaging with you today. Appreciate the opportunity. If we could go to the next slide, please. So, as is our custom, I'm going to give a land acknowledgement. In the spirit of truth and reconciliation, we would like to acknowledge and recognize that we are joining this session from the traditional lands of the Anishinaabe Nation, specifically the Chippewa Tribe Council, comprised of the Chippewas of Beausoleil, Rama, and Georgina Islands First Nations. We also acknowledge the Potawatomi of Moose Deer Point, and the Mohawks of Wata, Georgian Bay, Moose River, and Barrie South Simcoe Métis councils in this region. The Huron-Wendat and Haudenosaunee Confederacy have walked this territory over time, and we recognize and honor our relationship with these peoples and these lands, and are grateful for these lands for many reasons, including the benefit provided to physical and mental health for the people living in these lands, and the protection that they provide to climate hazards. If I could go on to the next slide, please. Waiting for the next slide, thank you. So we will be presenting on our experience as a local public health unit, a public health authority, in the context of where we live, the system that we operate in. We will be speaking with regards to our role in addressing climate change, and also how we've worked locally to address the issue and opportunities for scaling up with climate action. Could go on, please. So located in Southern Ontario in Canada, one of 29 local public health authorities, local health units. Our mandate is to protect and promote health and prevent disease for our population. We serve about 600,000 people, 26 municipalities, of which there are 4 First Nations communities, a mix of urban and rural, forested areas and farmland, industrial areas and very natural areas, rapid growth and aging, and increasing population diversity. And we have many programs in public health and include addressing climate change with a limited degree of dedicated resources, but leveraging across the agency with people who provide other programs. You could go on to the next slide, please. So in 2017, we did a comprehensive climate change vulnerability assessment for our district. We are among the first of health units in the province to do so. And it looked ahead in increments of 30 years into the future, out to the 2080s. And in that report, we identified that there would be quite a substantial increase in impacts as you go forward in time, with a great augmentation in tropical nights, nights which are 20 degrees or more, which are linked with particular health impacts, and extreme heat events, as well as a great increase in the prevalence incidence of extreme weather events. But I would say that we've actually experienced in that 7-year period substantial events. So some of them have, of course, been in the summer with heat events. We've seen a great increase in forest fires from coast to coast in our country. And where we haven't had forest fires directly impacting on populations, we've had smoke spread, for instance, into Southern Ontario, into our territory, and very much into the United States from our territory. And we've also seen some odd winter events. So in the last year, at the tail end of the winter, we had a severe ice storm that extended for some 2 weeks and put some 400,000 people out of power with extensive tree damage and property damage. But we've also seen quite a substantial increase in the incidence of vector-borne disease, such as Lyme disease. And because of the fires in the north, there have been multiple requirements for evacuations of communities, Indigenous communities, a move to the south during those emergencies. And our health unit has participated in housing them. So this timeline shows adverse weather events. And one point you might draw from this is that they're becoming more common as one moves forward in time to the present. We've seen many more impacts in recent years than we did over the decades that preceded it. If you could go to the next slide, and over to you, Sarah.
Great. Thank you. So local climate hazards significantly are impacting population and health equity in our area, and this will only increase without scaling of climate action. And I'm not going to dive into the local impacts today, but I really wanted to emphasize that this influence on health and health equity is so profound because of the widespread and adverse effects of climate change on the determinants of health. Further, climate change, health, and health equity are deeply intertwined. They intersect in complex, dynamic, and multidirectional ways, mediated through the determinants of health. And this really shapes climate vulnerability, climate resilience, and the distribution of climate health outcomes. And this relationship really contributes to climate change being that threat multiplier that we know worsens health outcomes and inequities and strains public health systems and other sectors and services that are really required for good health. And not only does this create new health risks, it also reduces our capacity to effectively respond to climate change, but also to act in a proactive nature. All of these impacts can be acute, chronic, cumulative, and compounding. And they don't only just impact current health and health equity, they also influence how we experience future climate health risks. This relationship between climate change health and health equity mediated through the determinants of health, importantly, also creates the potential to turn climate action into an opportunity multiplier when intentionally designed. I'll speak to that a little more shortly. So on the screen, you can see a number of different challenges and facilitators to scaling up climate health actions. And these are only examples. They're not intended to be an exhaustive list, nor are they unique to our agency as a local public health unit, other public health authorities. Yeah, they're quite common, at least in our local area. And they're also often interconnected. I'm not going to point out all the challenges and facilitators, but I do want to point out one challenge, which is a narrow framing of climate health action. So when we overlook efforts that address the determinants of health as drivers of climate change and climate vulnerability, this can really hinder the efforts to scale up climate health action. Some key enablers is actually using climate data, applying a health and health equity lens to our work, fostering collaboration and engagement, and implementing practical and actionable strategies where we are. So scaling up climate health action and resilience requires involvement and collaboration across many different sectors and levels of government, as well as affected populations, each contributing unique knowledge, experiences, and priorities. And local public health authorities, whatever that may look like in your jurisdiction, are one of these key partners. And climate health action spans a continuum of upstream and downstream efforts. They include immediate responses to climate health risks and strategies to prevent future climate health risks. And public health inherently aims to enhance resilience by improving the determinants of health and equity, thereby reducing exposure, sensitivity, and increasing adaptive capacity in our communities. Further, climate action implemented across different sectors can also support public health goals. And this is where climate action as an opportunity multiplier really comes in. Climate action can create a range of benefits for society, not only addressing climate change, but really advancing health and equity and resilience, creating thriving communities despite climate change. And this drives further opportunities to build that climate resilience and facilitates multi-solving and unlocking of co-benefits. This is particularly true when we intentionally integrate health and equity into climate action considerations, when we bridge climate adaptation and mitigation, when we focus on those upstream actions to address the underlying causes of climate change, climate vulnerability, poor health, and inequity, and by applying a social and climate justice lens to ensure that those most affected by climate change are prioritized and that unintended harms are avoided. So this slide offers a snapshot of our climate health action framework, which is designed to be flexible and to help us scale up climate action as we continue to grow. It has 3 goals and objectives that you can see on the slide, as well as 6 core roles that are represented in the inner rainbow circle, and 6 guiding principles represented in the outer blue circle. And these roles and the principles are really interconnected, and many of the strategies that we use span multiple areas. It currently guides our climate health portfolio, and it's our goal that this framework or a version of it will help us to embed climate health actions and lens across the department to help us scale up climate action locally. So over the next few slides, we'll highlight opportunities for local public health to scale up climate health action with some specific examples. And you'll see that these opportunities and examples leverage many of the facilitators that we introduced earlier and align with the framework core roles and principles. So the first thing is relationships are absolutely essential to this work. They are necessary for collaborating and understanding community needs and driving action. And local public health builds relationships and connections internally within our field across different sector partners and with populations to raise awareness, identify opportunities, inform, and take action. And in many ways, we act as a connector in our local communities. I wanted to highlight one specific action. So we have a Climate Change Exchange, which is our regional intersectoral network that fosters collaboration, knowledge sharing, and resource exchange. And it has helped us to build a really strong network of allies and relationships and has led to new opportunities for climate health action locally. Notably, our last two meetings were impacted by climate-related events. The first was impacted by the ice storm that Dr. Gardner mentioned, which completely canceled our meeting. And the second occurred during a significant heat wave this past summer, where many of our members were unable to attend our meeting because they had to engage in the response to the heat wave. And tomorrow we have our third meeting of the year, and we're actually taking time to speak about how climate change and our climate work is affecting our own mental health upon the request of one of our members. We've also developed an engagement plan to support preparedness, resilience, and response planning to hazards related to heat, air quality, and wildfire smoke. This is a new engagement plan for us, and it's already helped us to build relationships internally within our organization across programs and disciplines, and also to identify opportunities for collaboration and engagement with future engagement with external partners. Another thing that we're able to do is really support collective impact and climate change and health in all policies through coordinated action that shape, implement, and modify climate health action. So these efforts are really, again, supported by those relationships that we spend time to build. And through this, we've been able to influence municipal as well as school board climate mitigation and adaptation plans, municipal official plans, and other policies and strategies to embed a health and equity considerations into these plans that really guide climate action and healthy community design in our communities for years to come. We also work towards building capacity and scaling up climate health action locally, both for our own organization and our local community. And one way that we do this is through assessment and surveillance, specifically climate change and health, vulnerability, and adaptation assessments. So as Dr. Gardner said, we have completed one in 2017, and we're currently working on revitalizing it. And this tool really informs the development of climate health information, programs, policies, actions across public health and municipal and community partners. Another example, we recently partnered with the Ontario Resource Centre for Climate Adaptation to develop a guide that helps our partners integrate health and equity into climate adaptation, providing tangible examples, ideas, and starting points to do so. And then we want to take all of the knowledge that we've learned, all of the evidence and information we have about climate change and health, and apply that to create or guide climate health informed programs, activities, and climate actions. And this is important even if it's not directly the responsibility of a climate health portfolio in any one given organization. And this is because climate change affects our entire agency operations capacity and really intersects with so many different topic areas that our agency deals with. And so to remain effective in protecting and promoting health, which is our mandate, we need to integrate a climate health lens to various programs and departments. And this really takes time. It involves influencing areas beyond our immediate reach, rising awareness, building buy-in, and reshaping existing processes. So we've been able to include this climate health lens quite strongly in health, air quality, and wildfire smoke initiatives, and we're working to expand that to all hazards. It's quite strong in informing our vector-borne disease program. We're working to increase climate health connections in various communications, and we've worked closely with our dietetics to make that linkages in their food and nutrition messages. And we also need it to inform our response to climate-related events. And I'll pass it back to Dr. Gardner to help close us off here.
Thank you very much, Sarah. So moving forward, in keeping with all that you've heard from us, we need to update our climate change health vulnerability adaptation assessment and intend to do so in installments rather than as a single product. And we want to continue with a health equity lens, focusing on those who are most vulnerable, and also being able to mobilize with partners to act on the knowledge that we generate, and also working with partners to actually generate that knowledge in the first place going into the assessment. So we need to continue, strengthen our partnerships, and we have been engaging with our Indigenous communities, our four First Nations communities and other Indigenous groups, and we'll continue to do so. And we will continue to work across the agency with our differing programs and departments with regards to the various impacts of climate change on our other programs, taking an all hazards response to our planning. Sarah, if you could proceed to the next slide. So key takeaways. Certainly climate change is an increasing threat to population health and a strain on the health of the population, but on public health systems and other sector partners, municipalities, healthcare providing agencies, et cetera. So public health agencies are critical to help in the response to climate change, to plan and respond. We see climate change certainly is a major threat now and into the future, but also an opportunity to address ongoing health issues to help shape planning for our communities to be healthier by design for other issues such as chronic disease prevention or injury prevention or mental health promotion. And therefore, when it comes to scaling up, of course, we need to continue with our partnerships, relationship building, but we know that in addition to looking to the future, which is really the approach we were taking a decade ago, thinking of climate change as something coming, we need to think of it now as something that is here, acute, impacting us now, that as we help agencies and communities adapt and change to address climate change, we also are actually responding to the acute threats that impact us even today. So we're an essential partner, local public health, in response to climate change, local climate health action. And we are certainly very engaged and willing partners in responding as we scale up for climate change action. Next slide, please.
I think we're done.
Aha. So I do thank everybody and would hand it back to Cecilia.
Thank you both so much. And I'd like to invite Agnes and Tamir back on. We have so many amazing questions in the chat, and I think many of these will be answered throughout the course. Some themes have arisen in the Q&A, and I'd like to sort of maybe turn attention to those. So one of the things that has come up is that the reality is that many of the upstream causes of climate and health impacts are upstream of the health sector. So, for example, thinking about vulnerability, thinking about risk, we think about housing, we think about transportation, sectors that are not directly controlled by the health sector, yet have huge impacts. And we saw a case study here on universal healthcare, and thinking about, how can we sort of take a more broader approach to building resilience, given sort of the conditions we're in. Wondering if you all could comment on that, and furthermore, think about how we can engage actors outside the health sector as we're seeking to scale solutions.
Cecilia, if you like, I could give some local
Please,
examples
go ahead.
in our backyard. So in public health, although we work with healthcare partners, we also work with municipalities and conservation authorities and others. And what we're seeking to do is change the design of communities to be less vulnerable. And so that would mean changing them to be greener and to change or help municipalities identify the need to change storm water management and to have a reduction in the heat island effect that you see with concrete city centers with more greening, and ideally support access to cooling centers for vulnerable populations during heat events. We note from experience a heat dome that occurred in British Columbia 4 years ago that lower income housing without air conditioning is a very vulnerable situation, particularly those who are also medically fragile. And so any changes that can be made to make housing less vulnerable in that way is critical. So all of those things are really important to health and are outside of healthcare per se. I think perhaps, Sarah, you're much closer to the work if you had anything further to add.
Or maybe we'll go to Tamer. What's in it for these sectors? Okay. How do we get them to partner, right?
Yeah, no, I think this is a fantastic question, and it speaks to what Chuck and Sarah were speaking about in terms of the determinants of health. That many of obviously the determinants of health lie outside the health sector. So I think it's critical that we address this. Now, for the way I see it is that we need to be able to identify, actions that need to be taken within the health sector on adaptation and mitigation, but we also need to be able to pinpoint actions that need to be done by other sectors with health co-benefits. And I wanted to make the distinction between those two because they're while they may seem different, they're actually complementary. Mm-hmm. And in my view, just to perhaps add further on what Chuck was saying, there are a number of critical sectors that we need to involve, energy being one of them, because of the focus on moving towards, energy efficiency, for example, in healthcare service delivery. WASH is extremely important to bring in, people from within that community, really to have more of that, discussion around water, sanitation and hygiene, agriculture and the links to food security, and obviously, impacts, from that on nutrition. But the way to do this, in my view, has to be done through a platform that brings all of these partners together. And I think, again, the Belém Health Action Plan, and I'm putting it as a segue also for Agnes to come on this, but the Belém Health Action Plan is laying the foundation for something like this. It is providing us, if you will, with that entry point where we could have this multi-sectoral discussion around adaptation and adaptation mechanisms, understanding that biodiversity is a big part of this, and we need to keep a focus, on that, in the discourse. So I believe that these discussions are already happening, and in fact, the energy sector right now, as we speak, is investing hugely in the solarization of healthcare facilities. They're getting into health programs. I was in Nigeria a couple of months ago, and they were expanding hugely what they're doing in terms of solarization of primary healthcare facilities. But the likes of obviously the WASH and the agri sort of business that comes into this is going to be important. My final point, and I'll pass it over to Agnes on this. Yet again reiterating the role of the private sector. The reason I'm saying this is because as we've been going into these discussions, we've realized that there's a huge role for the private sector in this space. When it comes to energy, they're moving towards business models that look at energy as a service, which no more takes you in just thinking about the capex that is put around, for example, energy efficient solutions, but it's getting you into the world of understanding how the entire business model operates so that there is profit and it's a win-win situation for all parties involved.
Great. Agnes, over to you.
Yeah, I think this is an excellent question. As I've mentioned in my presentation, there is no way to solve everything in the health sector, but there are things that only the health sector can do. And one of them is to strengthen health service, to strengthen health system, to adapt the whole program, everything that we work with, that we think that can be affected, needs to be done differently. I can talk about, for instance, vaccination. There is no way you can keep the coverage we need to measles if we don't have a system that can survive and quickly react and quickly be up and running after floods, or if the services are have difficulties to logistics distribution of vaccines, for instance, if we have drought, as we had in the north part of Brazil, where the rivers became dry, so there is no way you can get to remote places. But in every single aspect of what we do as the health sector, we need to think differently, and we need to think in solutions. There is no one solution fits all. That's the reason it's a very complex problem. We need to understand what we need to do in each part of the work we do in a territory, because it may be different from the others. But the principle is the same. We need to assess vulnerabilities. We need to assess what needs to be changed and then do it. And of course, we need the private sector. But once we have a public sector that responds for the majority of the healthcare, this is where we need to do most of the adaptation. So sometimes we talk about solar panels as mitigation, but when you live in remote areas, solar panels may be the only way you get energy when you're isolated in any situation. And that's the way you could keep the cold chain up and running. Or if you think on, if you need to deliver, for instance, insulin for diabetic people, if you cannot provide that quickly after floods or any other disruptive impact of climate change, of course, this will be a problem, but it will become a disaster and not only an interruption of services. And so you can think of many other things. I know for maternal health, if you don't have any provisions in the cities for people living in slums or, very poor households to be protected in heat waves, you have a high probability that you have many complications related to early delivery, no birth rates, and many other problems related to maternity. And this could go on and on with that. So the solutions are not always in the health sector, but we have something nobody else has. We have data to provide. We can show how the impact is really effectively is happening in the whole population, and we can show the numbers and we can share that. And this is a high pressure for the whole system. So then we can negotiate with the other sectors on how to improve that quickly. But this needs to be done by who makes decision in the health sector. It needs to be understood by whoever is preparing this communication with other sectors as well.
Thank you so much. Sarah, any last thoughts on this from your experience?
I would just say like relationships are so key and they take time to build, but that's where we have seen locally the magic happen. And a lot of these like health supporting climate actions that are outside of the health sector really happen at a municipal level. So building those relationships with our municipalities and helping them understand where we're coming from, we can better understand where they're coming from, create a common language that can just build the synergies. I'd also say that there's such great work in climate action across different sectors. And when you are able to come together and see what that is, it's inspiring and it helps relieve some pressure, I think, on ourselves as public health professionals. But again, building those relationships and opportunity for us to share that health and equity perspective with other sectors is absolutely vital, especially at a local level, at least for us where we have that local impact.
Yeah, that's amazing. Yep. Yeah, we can't move faster than trust, and those investments in relationships are so critical to the work that we're doing now. So let's take that extra time. Really great thing to end on here, Sarah. Well, I'm going to bring up a couple more slides. I want to give a huge thanks to our speakers today for sharing your expertise, sharing your time. With your permission, we will make your slides available. And for many of the questions we were unable to answer, please stay tuned. We have sessions running throughout the next 6 weeks. Our next session will be Tuesday, where we will be talking about why a pilot is not enough, the challenge for health authorities in scaling up adaptation. Again, I'd like to remind everybody, if you would like to submit a case study, which we would consider for presentation in one of our upcoming sessions, please do so using the link which is in the chat and also will be on the screen momentarily. If you do not want to do a case study, you don't have to answer the form. It's just for people who want to opt in.